Reproductive disruption is a very common complaint and symptom of adrenal fatigue. This is Dr. Lam, founder of drlam.com. When a woman tries to conceive, and barring any structural problem, such as tube issues or sperm count, the body, if it doesn't want you to get pregnant, will effectively be able to do so by putting roadblocks in front of you. Now, this is a physiological event, and the end result is difficulty in menstrual cycle. Even if you are able to get pregnant, it is hard for the womb to stick to the uterine wall, and then there's spontaneous miscarriages. This type of miscarriage is very classic in that it usually happens in the first trimester, especially anywhere from week 6 to week 12. Because of the lack of progesterone, or insufficient, we cannot say lack, because the body in the adrenal fatigue state tend to have less progesterone than it should. And if you want the progesterone, or if you want the womb to stick, you need a lot of progesterone. Now, the amount of progesterone that's put out by the body usually is automatic, and it will scale up over time in the first 12 weeks. But in the case of adrenal fatigue, the body is simply not able to put out that progesterone load because it is trying to make cortisol instead. And progesterone is one of the precursors to make cortisol. So the body is kind of caught. Reproduction is therefore not perceived as an important event, so the body shuts it off or slow it down. And it's not unusual for people with advanced stages of adrenal fatigue not to have period for months. And interestingly, even you do IVF, the success rate is very low because the IVF can only help the implantation, but it cannot help you to make sure that the womb stays. The body, in its infinite wisdom, will make that decision. So one of the most important questions that young women who have adrenal fatigue have to consider is how healthy is the menstrual cycle. We deal with these people, we deal with these situations, and we have to make sure that it's not only about getting pregnant, it's about getting the body to have a strong adrenal system so that it can not only handle the IVF or the pregnancy, but have a healthy baby at the end without reproductive disruptions and postpartum crashes. So reproductive disruption is a very big area, very serious areas, and those or anybody who has serial miscarriages must pay attention. But it comes as no surprise as a symptom of adrenal fatigue because it makes total logical sense. And in fact, one of the things that we find is that as the adrenal heals, the spontaneous recovery and the spontaneous pregnancy that's achievable often goes up. So it is not something that is unresolvable, but it's something that you must understand how it is related to adrenal fatigue, so you don't do the wrong things by forcing the body into fertilization when it's not ready. That can be a disastrous strategy. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.